Most docs give statins for LDL, cholesterol level. That's not usually what I give it for. I give statins for cardiovascular inflammation. It's a very different reason. But if you've got plaque, it's really clear that you've been in a cardiovascular inflammation stage. You didn't know it, you didn't feel it, or you would already know that you have plaque before we discovered it. Now, it's a thing, there's a technical term, I'm going to use it, pleiotrophic. There's a pleiotrophic mechanism. Again, sounds technical, but if you have done any third grade astronomy or maybe 12th grade astronomy, you might have heard the term, the Pleiades. You remember the Pleiades? What was that? The seven sisters? So Pleo is the root for that word, and it just means many. And here's the bottom line. There's more than one mechanism for statins. Most docs and patients think about lowering LDL. That's not what I usually use it for when I use it. I usually use it for decreasing cardiovascular inflammation. It does a good job of that. Some statins do, some statins don't. For example, the most popular statin, Lipitor, does not do as good a job on cardiovascular inflammation. It does a great job of lowering LDL, but it doesn't do a good job on cardiovascular inflammation, especially if you're female. Well, that's half the population. Or if you have prediabetes. Well, again, prediabetes is more like 80% of the population. So I don't use Lipitor. I've used it maybe 1 or 2 patients total over the past decade. There are specific statins that tend to do better. Rosuvastatin, Livalo, pitavastatin, some of those. And again, for this purpose, for lowering cardiovascular inflammation, those lower doses are very helpful, and that's almost always all you need. And think about it, for those people that are having symptoms associated with their statins, guess what these lower doses do to that? Greatly decrease it.